Hi, thank you for signing up for our free dental implant seminar. Actually, this is going to be the online version, so you don't have to come into our office to hear what I will have to say about the dental implant seminars. So we can save time and save your trip, and you can make the better educated decisions through online version of implant seminar. I will go over briefly about what the implant is. I'm pretty sure you know about that, and that's why you signed on for our implant seminars if you wanted to find out more about this. Um, the more importantly, I will also share how we do things differently compared to other offices that does not have what we have as far as the implant placement. It's very well advanced protocol, and I'll be going over that also after the education session of about an implants. Um, this is Westlake Dental Center, and the dental implant is it provides a very confident smile, and you probably know why you need dental implants. It helps with your smile, with chewing mostly. That's a huge change. If you are no longer able to eat food, eat the food that you want, it's very upsetting for many patients, and that's why patients come in and looking for dental implants, because that's the next best alternative to the natural teeth. Okay, so the purpose of the informational seminar is to educate you and discuss what you need, some options, and help you decide what you will need. Let me just fix this a little bit here, try to bring it down. Okay, so you see our logo here, Dental Implant Center, the Westlake Dental Center. Okay, so what happens when you lose teeth and your bone shrinks, your teeth shift, and your facial profile changes, and there are other problems periodontally. When you lose teeth and your bone shrinks, and your teeth can shift, and as your teeth shifts, and it creates some extra pockets where the food can get stuck in there and cause more problems later on. As you can see here, shifting teeth can bring about negative cosmetic changes to your smile and can also damage your ability to chew and bite properly. Facial profile changes, and as you can see, you can have more wrinkles around your lip and your face. As the teeth are missing, the bone will shrink. There will be other problems, periodontal disease, gaps between teeth. You'll have some problems with your jaw joint, because if you miss teeth on one side, you'll favor the other side for chewing, and it can create some problems with the joint, and it can make your face a little bit bigger on the side that you chew more often, and obviously you will have a poor nutrition. Mostly the patients complain is that they can't eat the food that they used to eat, and if the front teeth are involved, then they're embarrassed about their smiles. And what the dental implant can do for you is you can eat the food you love, and you can be confident about your smile again. Okay, the patient's main concern is who do I go to? Who can I trust? I lack confidence. I'm ashamed of my smile. So the biggest breakthrough is that you actually come to the consultation. Don't be afraid. Don't be closed about what your mouth look like. You have to push yourself, to get to us, so we can discuss your treatment options, so we can reverse the problems. Okay, so there will be some options available as far as restoring missing tooth or multiple teeth are concerned. One of it is mainly what we're discussing is dental implants. Dental implants are an excellent alternative when compared to other traditional method of replacing teeth, such as partial dentures or full dentures. Dental implants are permanent, natural looking. They do not damage adjacent teeth. Unlike the bridge, you would have to cut adjacent teeth in order to fill the missing tooth space, and that's not what we want. Then implant is a titanium, medical grade titanium, which replaces your root of the tooth, and it integrates with the bone. The bone heals around the implant, which is termed osseointegration, and after it heals about 3 months of a time, and then the crown can be placed in various ways. Dental implant can stop the bone loss, it can prevent shifting your teeth, can increase bite power and functionality, and but unlike your natural teeth, the implant doesn't have a nerve ending, so it does have a little bit of a change in the sensation when you bite down, but it's the next best thing to the natural teeth. Okay, dental implant is osseointegration, as I explained briefly to you minutes ago, and the bone heals around the implant, and that's osseointegration, and after that the crown can be placed. Implant itself has 97 to 98% success rate, but the maintenance is very important afterwards. If any implant procedure will fail, and that it does happen sometimes, and it's during the healing process, we can tell by looking at the x-ray, especially during the first 8 weeks of a time. Are dental implants right for you? Let's talk about the situations and options. Single missing tooth, traditional way would be crowns and bridge, or flipper. These days this is not probably an option. The best implant option would be dental implant supported tooth. Single missing teeth, as one of the option is to put a bridge in between, but obviously the adjacent teeth will have to be cut down in order to make this bridge work, and this is not the standard of care these days. Removal flipper, it's very inconvenient. It moves around in your mouth. It breaks. If you have a single or couple teeth missing and try to fill the gap with a flipper, you would have to take this out when you eat, and that's not the purpose of it. The best way is to do the implant. It replicates the natural teeth. It preserves healthy adjacent teeth and also preserves the bone. And patients' implants don't have cavities, but the implant can get some gum disease around the thread of the implant, and that's what needs to be addressed every 6 months for proper maintenance. There are situations for multiple missing teeth, and the options are the larger traditional bridge, partial denture on only one side. It usually doesn't work, and then also the dental implant supported bridge is the best option. The longer span bridge, more teeth has to cut down. The surface area of the missing teeth covering the missing teeth area has to be less than the surface area of the root, and that's the protocol that we go by. And at the same time, this area between the fake tooth and the crown, this can get a cavity around the crowns. The partial denture, it's not really, you can't really chew food with this, and what I find out is because of the partial denture, the tooth adjacent to the missing teeth where the partial dentures are sitting are damaged many times, and they end up losing teeth more and more. So the multiple missing teeth, to properly restore it, we can put multiple implants, ideally per tooth missing. Depending on the case, we can create some bridge situation with the implants, and this is more comfortable and more functional. It doesn't come out at night, so this is the way to go, and a lot of people know this already, that this is the best option. The multiple teeth missing, the denture ridge, I mean, you don't want to get to this stage. The whole purpose of coming to the dentist and try to take care of your teeth is to prevent you from getting dentures. So if you are taking care of it, you shouldn't get to this stage. You can get the full denture that comes out at night. You can have this piece of, it's called a locator attachment, but this will still rock in your mouth. And you can have multiple implants, but still this comes out at night. This is a full implant, supported crowns and bridges, this would be the best alternative than removable dentures. This is fixed, which means that it stays in your mouth. Okay, so that's multiple implants, again, covering multiple missing teeth, and this is the best way to do it. What now? Okay, after you are done listening to this online version of implant seminars, you can go back to our website, www.westlakedentalcenter.com, and then you can there's an online form where you can enter your name and contact information, and write down the number of missing teeth, and we can start discussing your options and costs and much more. We can discuss about healing time and the kind of time frame and your finances, or you can call us. There's more than one way of reaching us, so don't hesitate to give us a call, and we can start the process for you to have dental implant supported crowns for your better health and for your better smiles. And thank you for your attention, and good luck.